I'm talking to Osteopath Oliver Gordon today. Hi, Oliver, how are you?
Hi, Joanne. I'm very well, thank you.
Wonderful. Oliver, today we're going to talk specifically about pediatric and cranial osteopathy. Tell me, what is cranial and pediatric osteopathy?
Well, cranial osteopathy was developed by a Mr. Sutherland and released to the public officially in 1956. And he devised a set of techniques that were to be used mainly on the bones of the head, the cranium, the cranial bones. And most people think that the bones of the head are really just one bone. And I think that the facts about it are very different. When we look at the anatomy of the head and the skull, there are many bones in the head. And many people talk about their temporals, and these bones here on the side of the head. And I think that there's two of those at least, one on each side, and they actually move. Not very much. Not like your finger or your back or something like this, but a little bit. And the cranial osteopathy is a very sensitive, gentle way of examining the bones of the head. And you feel a balance of this motion, which is supposed to go, let me do a little demonstration here, downwards and outwards, and then upwards and inwards. And it's supposed to happen about 10 to 12 times a minute. And the cranial osteopathy is feeling this rhythm, and it's feeling the balance in this rhythm, the left and right balance, the front and back balance, or just the balance between the different bones. Potentially even the structures underneath these bones, which are actually things that can cause problems for people.
You've said in previous interviews that the cranial osteopathy you would use on, toddlers, small children. Why would that be necessary?
Well, the theory is, and the facts say, that to have a natural childbirth, for example, puts number one, the mum under quite a lot of strain, but the baby that's being born actually has to pass through a very narrow passage under a lot of compressive stress, let's say, with the contractions, and also potentially for many hours. And this is a normal delivery. If we include some of the other things that happen, things like von Tu's deliveries, forceps, or even just a long labour, let alone something, a baby being in the wrong position or something like this, there are many, many variations. The cranial osteopathy is designed to release these bones via this very gentle method and feeling this rhythm. There are many babies that are born, they have problems with things like sucking, things like cholic, not sleeping, being irritable, and many times I see that the bones of the head are not actually balanced. You'll see a baby with a flat head or something like this. And we are trained to see these things and to give people advice and to actually release the bones themselves. So we do a range of things, whether it be advice on routines and sleeping patterns, or even feeding patterns and problems. We're very much up to date, and we see people all the time, so it keeps us up to date as well. I think often there are many products out there that even the doctors don't know about, and I hear about them from people as we talk and discuss people's problems. So as I said, we keep up to date like that.
Would you recommend that a parent brings a child to you if they've had a natural birth, irrespective of if the child is showing symptoms of problems with sucking or colic?
I think as a cranial osteopath, it's part of my job to actually help people of all ages. I've seen patients from 1 day old to 94 years old, 95 years old, and I really think that it's really about natural health. It's about treating the body as a whole, and on that level, I think that everyone should see an osteopath, without question.
Can there be any adverse effects when treating infants?
With the cranial osteopathy, it is so gentle. The babies often fall asleep during the treatment, and you're just left with a very calm, relaxed baby. There are many times I've seen people coming in with problems. I do one treatment, the baby sleeps for the afternoon, maybe misses a feed. This is probably the only adverse reaction I've seen. Most mums don't mind for the baby to have a good sleep and miss a feed, and they seem to be quite happy about this. And then afterwards, everything seems to calm down with these particular people. So I think that it's very, very unusual for there to be any negative side effects from the treatment. And generally, the babies very much enjoy it. And also, when I treat the adults, they enjoy it too. They find it very calming, very relaxing. For things like headaches, it's a great thing to help people.
Thank you, Oliver. Thank you so much for talking to us today.
It was great talking to you as well, Joanne. Thank you.